Cervical cancer is the fourth most common cancer in women, and in 2018, an estimated 570,000 women were diagnosed with cervical cancer worldwide, and about 311,000 women died from the disease. And we understand that the American Cancer Society's estimate for cervical cancer in the United States for 2022 are that about 14,100 new cases of invasive cervical cancer will be diagnosed, and that about 4,280 women will die from cervical cancer. And that's just too bad. Hello and welcome to the Spotlight on Food and Health Communications, your number one go-to source for credible and timely health information. My name is Victor Wabari, and today we will be focusing the spotlight on the cervical cancer disease, a disease common to women. We will be looking at its causes, its symptoms, the risk factor involved, and the way out. We'll take a break right now. When we come back, the conversation begins, and please do not stray. Welcome back. This is Food and Health Communications, your number one go-to source for credible and timely health information. My name is Victor Wabari, and this is the Spotlight. Today we want to talk about cervical cancer. First off, what is cervical cancer? Well, we understand that cervical cancer is a type of cancer that occurs in the cells of the cervix. And when you talk about the cervix, you're referring to the lower parts of the uterus that connects to the vagina. And we understand that cervical cancer is most frequently diagnosed in women between the ages of 35 and 44, with the average age at diagnosis being 50. It rarely develops in women younger than 20, and many older women do not realize that the risk of developing cervical cancer is still present as they age. More than 20% of cases of cervical cancer are found in women over 65 years of age. However, the cancers rarely occur in women who have been getting regular tests to screen for cervical cancer before they were 65. Now, what is the main cause of cervical cancer? Well, nearly all cervical cancers are caused by an infection with certain high-risk type of human papilloma virus. Human papilloma virus. I know that sounds ringing in your ears. We know that to be the Hpv disease. And as such, you can get Hpv from number one, any skin-to-skin contact of the genital area. And number two, vaginal, anal, or oral sex. And number three, sharing sex toys. With that said, what are the symptoms of cervical cancer? First, you must understand that many women with cervical cancer do not realize they have the disease early on, because it usually doesn't cause any form of symptoms until the late stages, and that could be very, very dangerous. When symptoms do appear, they easily are mistaken for common conditions like, menstrual periods, urinary tract infections, and the likes. With that said, here are some of the typical cervical cancer symptoms that you should look out for. Number one, unusual bleeding, like in between periods, after sex, or after menopause. Number two, vaginal discharge that looks or smells different from the usual. Number three, pain in the pelvis. Number four, needing to urinate more often. And number five, pain during urination. If you notice any of the symptoms, you need to see your doctor for an examination as fast as possible. Now let's talk briefly on the cervical cancer stages. After you've been diagnosed, your doctor will assign your cancer a stage. The stage tells whether the cancer has spread, as if so, how far it's spread. Staging your cancer can help your doctor find the right treatment for you. Let's start off with the first stage. The first stage of the cancer is the small stage. It may have spread to the lymph nodes. It hasn't spread to other parts of your body. So if you are in the first stage of the cervical cancer, it might have spread to the lymph nodes, but it might not have spread to all the parts of your body, depending on the stage your doctor tells you. If you're in the stage 2, the cancer is larger at this stage. It may have spread outside of the uterus and cervix or to the lymph nodes. It still hasn't reached other parts of your body. Stage 3. If you are in the stage 3, the cancer has spread to the lower parts of your vagina or to the pelvis. It may be blocking the uterus, the tubes that carry urine from the kidney to the bladder. It hasn't yet spread to other parts of your body. But if you are in the stage 4, the cancer may have spread outside of the pelvis to organs like your lungs, organs like your bones, and organs like your liver. With that said, what are the risk factors involved? Almost all cervical cancers are caused by human papilloma virus, a common virus that can be passed from one person to another during sex. The HPV is so common that most people get it at some time in their lives. HPV usually causes no symptoms, so you can't even tell that you have it. For most women, HPV will go away on its own. However, if it does not, there is a chance that over time it may cause cervical cancer. Other things that increase your risk of cervical cancer are these. Number 1, having HIV, the virus that causes AIDS or another condition that makes it hard for your body to fight off health problems. So if you are HIV positive, you might just be on a higher risk of contracting the cervical cancer disease. Number 2, smoking. If you are a smoker as a man or as a woman to be precise, you are on the higher risk of having the cervical cancer disease. Number 3, using birth control pills for a very long time, let's say for over 5 years. There are women who use birth control pills during pregnancy and after pregnancy. If you are into that kind of thing and you've been using birth control pills for over the period of 5 years, you are actually on the high risk of having the cervical cancer disease. Number 4, having given birth to 3 or more children. If you are a mother who have given birth to more than 3 children, you are, sorry to say, you are actually on the high risk of having the cervical cancer disease. Number 5, having sexual partners that are so many. In fact, in the first place, it is wrong to have more than one sexual partner. And so if you are the kind of person, the kind of woman who has more than one sexual partner, multiple sexual partners, you are actually on the high risk of having the cervical cancer disease. Now, finally, and most importantly, what can you do as a woman to reduce your risk of having the cervical cancer disease? Well, the most important thing you can do to help prevent cervical cancer is to get vaccinated early and have regular screening tests. Well, according to CDC, the HPV vaccine protects against the types of HPV that most often cause cervical, vagina, and vulvar cancers. We understand that HPV vaccination is recommended for preteens aged 11 to 12 years, but can be given starting at age 9. So if you have your teenage girls who are between the age of 11 to 12, or probably from the ages of 9, gets them encouraged to go get vaccinated against HPV. HPV vaccine also is recommended for everyone throughout the age of 26 years if they have not been vaccinated already. If you are a woman, you're already 26 years of age and you have not been vaccinated against HPV, please go get yourself vaccinated against the HPV. HPV vaccination is not recommended for everyone older than age 26 years. So you need to be vaccinated between the ages of 9 to 26, as the vaccination is not recommended for women above the age of 26 years of age. And this information is actually coming from the CDC. However, some others aged 27 through age 45 years who were not already vaccinated may decide to get the HPV vaccine after speaking with their doctors about the risk of new HPV infections and the pause. So if you are a woman who is above the age of 26, let's say 27, 28, and you've not been vaccinated, go see your doctor first. And if they counsel you to go ahead to take the vaccine, then you can do that. Also know that cervical cancer can be treated. It is not a death sentence. If you've been diagnosed with cervical cancer, it can be treated. And there are actually 3 ways of its treatment. Number 1, it can be treated through surgery, it can be treated through chemotherapy, and finally, it can be treated through radiation therapy. Go see your doctor, and whichever one works for you is actually fine. And this is where we draw the anchors on today's episode of the Spotlight. We have looked at cervical cancer in women. We have talked about what causes it. We have talked about the symptoms. We've talked about the risk involved We've talked about how you can reduce your risk, and we've also talked about, I've told you that it is not a death sentence. It can actually be treated. This is us at Food and Health Communications saying to you, be informed, be aware. Go get vaccinated as a woman of the HPV and be safe out there. Till I come your way next time, my name is Victor Waberry. Cheers.